It's something that I want to ask the CMO because I have been bombarded with a number of persons have been asking about Pennywise, and I'd like the CMO to tell us, what is happening.
Okay. All right. So it is related to the case that we would have had, not the 140 case 139. So basically, as we have discussed, the way this epidemic has progressed from the start, there are what we call simple cases and there are complex cases in terms of public health tracking and epidemiology. So there's a simple case that someone will have a viral illness, will have COVID-19, and stay at home, live by themselves, and basically don't move when they have signs and symptoms, which is a simple sort of public health tracking event. And it limits the amount of spread that occurs. So in this particular instance, what has happened is that the person would have been ill for more than a week, having signs and symptoms, and would not have restricted themselves to movement within their homes, would have functioned as normal. So moved about the community, gone to different places. In the household itself, there would have been upwards of 8 persons visiting or live or residing in that particular household. So those persons who visit or live in that household become primary contacts of the case. So from that, anyone that was in contact with the primary contacts now becomes secondary contacts. And as we have showed time and time again, the triad of infection goes in a triangle, starting with the case and then going to primary contacts, secondary contacts, tertiary contacts. Now, the person has been ill for about a week and has moved about, as I said. One of the primary contacts would have interacted in some way with Pennywise. We noted two closures of 2 outlets on the Charlotte Street, as well as the Long Circular Mall branch, which we closed this morning, asked them to close. The closure is for sanitization. We will do line listing of the staff, as well as we will do testing as necessary of primary, secondary, tertiary cases. There would be closure later today of the FCB El Socorro branch as well. And as it goes in terms of the investigation, there will be further closures that may have to take place for sanitization, for line listing, and for continued tracking. Remembering that this is the first case we have had of this nature for over 80 days, and we want to ensure that this case, there's no further spread and that we are able to identify exactly where this case comes from, which will take a few days of investigation as well as testing before we can make a definitive statement as to whether we think it has come because of contact with someone that may have traveled or possibly contact with a healthcare worker, but we need to do the investigation and complete it before we can say with definitively what is the source of this particular case, whether it is the primary or is it linked to another case that we may find along the way. Mr. Cox?
Thank you very much.